Hello everyone, this is Dr. Sam and this video is about MRI appearances of hepatocellular carcinoma. Hepatocellular carcinoma is a primary malignancy of the liver. It is the most common form of liver cancer. The usual causes are chronic hepatitis B and C infections, liver cirrhosis, alcohol-related liver disease, non-alcoholic fatty liver disease, and non-alcoholic steatohepatitis. Blood tests and tumor markers for hepatocellular carcinoma include alpha-fetoprotein, AFP. It is the most widely used tumor marker for HCC. Usually the AFP levels are elevated, but it does not happen in every case of hepatocellular carcinoma. The liver function test can also be abnormal in a hepatocellular carcinoma patient. Elevated levels can indicate HCC. Des-gamma carboxyprothrombin (DCP), which is also known as prothrombin induced by vitamin K absence 2, is another marker specific for hepatocellular carcinoma. Its elevated levels can indicate HCC. AFP L3% is another marker which is associated with hepatocellular carcinoma. It's useful in patients who do not have elevated AFP levels and are suffering from chronic liver disease. These are contrast-enhanced T1 weighted images of the abdomen showing the liver. The image on the left is a normal liver, and the image on the right is a liver with hepatocellular carcinoma. These images are in arterial phase, which is 20 to 35 seconds after contrast injection. The normal liver will have a homogeneous appearance without much enhancement, and there will be no focal mass within the liver. Hepatocellular carcinoma will enhance during the arterial phase. Marked hyperenhancement or intense uptake of contrast will be seen within the mass. It enhances because the tumor receives its blood supply from the hepatic artery instead of the portal vein. So this enhancement during the arterial phase is usually seen in a hepatocellular carcinoma. The portal venous phase is 60 to 70 seconds after contrast injection. It is the next phase after arterial phase. The liver has increased enhancement with enhanced portal vein. This is how the liver looks like. The hepatocellular carcinoma will show washout during the portal venous phase. The lesion will become hypointense. It will become darker than the surrounding liver parenchyma. This enhancement during arterial phase and washout during portal venous phase is usually seen in hepatocellular carcinoma. Another feature that can be seen in some cases of hepatocellular carcinoma is a capsule appearance during portal venous phase. A hyperintense peripheral rim can be seen during the portal venous phase. This bright border around the tumor. After the portal venous phase, we have delayed phase, that is 3 to 5 minutes after contrast injection. The liver parenchyma is more enhanced in this phase. It is brighter. The capsule appearance can be seen more clearly during this delayed phase. The hyperintense peripheral rim is more prominent. This is a non-contrast T1 weighted image. This is how the liver appears. A hepatocellular carcinoma usually appears as a hypointense mass in T1. This is a T2 image of the liver. It has an intermediate to low signal intensity. Hepatocellular carcinoma usually appears hyperintense on T2, so a hypointense appearance on T1 and a hyperintense appearance on T2 image is usually seen in hepatocellular carcinoma. If the patient has chronic hepatitis B or C along with liver cirrhosis, the diagnosis becomes more clear. This is another case of hepatocellular carcinoma. It is a T1 contrast-enhanced image. The mass is showing hyperenhancement during the arterial phase. The mass shows washout during portal venous phase. It also has a hyperintense peripheral rim, which is termed the capsule appearance. The capsule appearance is seen more clearly during the delayed phase, which is 3 to 5 minutes after contrast injection. This is another case of hepatocellular carcinoma. It is a T1 image. Hepatocellular carcinoma usually appears hypointense. In a T2 image, the mass appears hyperintense. Increased T2 signals are seen within the tumor. This is a different case of hepatocellular carcinoma. The tumor is large. On T2, it is heterogeneous and hyperintense. In a T1 image, this mass is appearing hypointense. This is a hepatobiliary phase. Hepatobiliary phase occurs 20 minutes to a few hours after a hepatocyte-specific contrast injection is used. The liver is very bright. In this phase, it shows strong enhancement. Hepatocellular carcinoma usually shows hypointense appearance in the hepatobiliary phase because HCC cells are less efficient in taking up and excreting hepatocyte-specific contrast agents, so they appear darker than the surrounding liver tissue. But this appearance is not fixed. Some hepatocellular carcinoma can show an enhanced appearance as well. It is variable. This is a diffusion-weighted imaging DWI of the normal liver. The B value is 800 seconds per millimeter square. The normal liver will not have any strong signals in DWI. Hepatocellular carcinoma will give high signal in the DWI image. This is a normal ADC image of the liver. Homogeneous ADC values are seen in a healthy liver. The liver will have homogeneous appearance. In a hepatocellular carcinoma, the mass will show low ADC values. This is because of high cellularity of the tumor, which restricts the diffusion of water molecules. Low ADC values can suggest malignancy. These heterogeneous areas around the tumor are due to cirrhosis. The heterogeneous ADC values are due to the presence of necrosis, fibrosis, or intratumoral hemorrhage. Lower ADC values have been associated with high-grade tumors such as hepatocellular carcinoma. Cirrhotic livers often show heterogeneous ADC values because of mixed presence of fibrotic tissue, regenerative nodules, and areas of differing cellular density. Here is another example of hepatocellular carcinoma. We can see the mass over here. It is a T1 image and the mass is hypointense. The mass is showing hyperenhancement during the arterial phase, which is approximately 20 to 35 seconds after the injection of contrast material. This is a delayed phase. Washout can be seen during this phase, along with a capsule appearance. We can see the hyperintense peripheral rim. This is the hepatobiliary phase. The tumor is hypointense during this phase. In T2 image, this mass is hyperintense. The mass gives out high signal in DWI. A hyperintense area is seen. It is important to combine the findings of T1, T2, non-contrast and contrast-enhanced images for diagnosing hepatocellular carcinoma. If DWI is done, it will help further in the diagnosis. This is a case of hepatocellular carcinoma with portal vein invasion. In a T1 image, a hypointense mass is seen, and this hypointense mass is also seen within the portal vein lumen, so it suggests portal vein invasion. In a T2 image, the mass is hyperintense. This hyperintensity is also seen within the portal vein. These are T1 fat suppressed images, which means the fat tissue will appear black. We get no signal from the fat tissues. The image on the right is a diffuse hepatocellular carcinoma with portal vein invasion. Diffuse hepatocellular carcinoma occurs when both the right and left lobes of the liver are involved. There is no focal mass. Instead, there is an irregular shaped mass. This is a T1 fat suppressed image. The mass shows hypointensity, and it also shows portal vein invasion. This is a contrast enhanced T1 fat suppressed image. In the arterial phase, we can see enhanced areas during this phase throughout different areas of the liver, and also enhancement is seen at the location of the portal vein. This is a delayed phase. We can see washout from the mass during this delayed phase. This is a T2 fat suppressed image of the liver. The diffuse hepatocellular carcinoma shows some hyperintense areas in T2 imaging. High signal is also received from the portal vein, so it suggests portal vein invasion. This hyperintense area is fluid. This is ascitic fluid. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.